Let me start by saying thank you very much for the opportunity to speak to you this time about my agency. I am somebody who has been appointed by the President at the beginning of his tenure in March to see to the regulation of health facilities, both public and private. So I am currently the acting registrar, which is the same as the CEO of the agency. HeFRA is the acronym, yeah? And the full name of the agency is the Health Facilities Regulatory Agency. It was an agency that was put together on the 31st of December 2011 by the Parliament of Ghana, and on the same day assented to by the President, the then President Mahama, to ensure that both public and private health facilities maintain certain standards. So in our operation, we ensure certain basic minimum requirements of personnel, people who work in the facility, and the equipment that they use, and obviously how they do their work, okay? But in terms of how they do their work and the regulation of the personnel themselves, we have the other councils. Medical and Dental Council will regulate doctors and their practice. Pharmacy Council will regulate pharmacists and their practice. Nursing and Midwifery Council will regulate nurses. So these are all health professionals. And in our job, what we do is to ensure that certain basic minimum requirements are in place in terms of the staff who will be up to date and in good standing with their professional bodies. So that is what, in a nutshell, that's what we do as an agency. As I said, the Act came into force in March 2012 because the Act was promulgated or enacted and assented to by the President on the 31st of December 2011. But the Act also provided for the fact that 3 months into that promulgation, the Act should be operational. So from that time on, the law states in Section 11, 1 and 2 of the Act that if you are a health facility, you can't operate in this country unless you have been registered or licensed by my agency, HeFRA. So what that means is that every facility that is in this country, which is a health service delivery facility, needs to register with us. Now, what it means is that you will come in, fill an application form. Once we're doing that, we take you through the requirements, all the kind of things that you need to have in place, depending upon the type of facility you want to put in place. Now, you will fill the forms. If we are satisfied with the forms that we provided with all the documents that are needed, we'll come and inspect your facility to make sure that certain things are in place. And then if we are happy with what we see during the inspection period, we'll give you a license for you to operate. Now, the license can be a provisional one, especially if you're a new facility. We'll give you a period of time to do what you say you're going to be doing, and then we'll come and do a full inspection later on. But during that time, or even when you have a long-term license, we will be monitoring your services. The Act says that every year, at least once a year, we need to go and check that facilities are doing the service that they say they're going to be providing. So it's kind of a long process, but it is to ensure that certain standards are in place by making sure that we meet the requirements that have been put in place by the Act. I would ensure, through my officers, that the right things are put in place. So if we do come to inspect your facility and there are certain things missing, it will depend on the seriousness of what is missing. If it's something that we could give you some kind of condition for you to operate, but that we can come again and check that that is in place, that is fine. But if what is missing is so serious a thing or a condition, obviously we will not allow you to operate because you will be jeopardizing the health of the people of Ghana. And we need to make sure that when we register a facility, people who visit the facility will have confidence that certain basic things are in place in terms of standards. Because the Act talks about basic minimum requirements of personnel and equipment. So, yes, people can be corrupt and take money and not follow the right things. But obviously, bad people will be everywhere that you can think of. But as I said, so long as I remain the registrar or the acting registrar, that will not come under my watch. I will make sure that doesn't happen. That any license that we give to any facility can be reliable and people can know that the right thing has been put in place, the right thing has been done. I would say that the agency, even though it's young, is in the process of making sure that Ghanaians become aware of their right to universal health coverage. We're working with the National Health Insurance Authority to make sure that people can access health. And the health that they're going to access is a health service or health delivery that is reliable. Now, we can say that since we've been in operation, or at least under my regime, certain facilities which were operating and were not operating properly have been able to come to us to regularize their situation. Now, HeFRA as an agency hitherto was not very well known. I can say that people are now beginning to know that there's that agency that works on behalf of the government of Ghana through the Ministry of Health to ensure that the right things are done in our health facilities so that we can have confidence in the service that people are providing. I could also say that we have, under my regime, I would say, we have collaborated with certain agencies to discuss with them how we can move this whole process forward in terms of making sure that the personnel staff are aware of what their responsibilities are, owners of facilities are aware of what their responsibilities are, and patients especially will know that they have a right to complain to us if there is anything that is going wrong. For example, I can share with you that in July last year, we had a visit from a gentleman whose wife had died through childbirth in a hospital that I would not want to mention now. But they knew that they could come to us and get some redress. They did come to us, and we were able to intervene and to find out what was wrong and to see how we could rectify that. I would call that as a success story. I would also say that now people are beginning to realize that if you do go to National Health Insurance and you haven't got a HeFRA accreditation, you will be returned to HeFRA to do the right thing. And we are trying to be positive. I can also say that we used to be in an office space near Tema Station by the magnanimity of Ghana Health Service, but the space was not good enough for the operations that were being charged to do. Now we are in cantonments in a better, I would say a better environment, not yet there, okay? I could also share with you that we now have people deployed in all the 10 regions of the country to go and ascertain the veracity of health facilities. I could also tell you that before now, or not long ago, HeFRA was only known in Accra. Nobody knew it anywhere. Now we are in the process of securing regional offices. I can say for sure that the National Midwifery Council has given us 2 offices in Accra, one in Koforidua, another one will be in Kumasi. We, through the national service program that we're doing with the service personnel, we are able to say that people are getting to know us closer to where they are rather than having to travel all the way to Accra. And I think that is a success story that we can share. Very soon, people are going to be able to contact us online, so they wouldn't even need to move and go anywhere to any office. They could make payments online as well. They could make mobile cash payments and things like that. So we're trying to make the regulation and the registration exercise and the process easier and better for our clients. And I'll call that a positive statement, and I'll call that an achievement that we have. But of course, there is a lot for us to do. There's so much for us to do, and we are very much aware of that, and that we are doing the best that we can as quickly as possible to make sure that regulation becomes a reality and becomes something that everybody is aware, whether you are a practitioner or a user of a facility. There are many challenges. I will tell you for nothing that we don't have a building of our own, so we are challenged by accommodation. We are working seriously on that with the help of the board that has been put in place since September, and with a very positive support by the Minister of Health, Honorable Kwaku Agyeman, who is really doing whatever he can to make sure that we are what we are in terms of accommodation. We also need to get the requisite personnel who will be able to help us do this. We're going to be doing registration, we're going to be doing inspection, we're going to be doing monitoring, we're going to be checking things. All this will be done by human beings, yeah? And we need to do that. And we are in the process of securing the personnel that we have. So currently we don't have the personnel that we require. In fact, I will tell you that HeFRA as an agency has not employed anybody as staff. What we have is staff on secondment from other agencies of the Ministry of Health and other people who we time as casual staff who are trying to stand in the gap whilst we're trying to deliver the service that we need to deliver. So we have that challenge. We have challenges of resources. As we speak now, we haven't got a single vehicle to our name as an agency. We're in the process of securing some. Better late than never, so we are doing that. So we have a challenge. We have a challenge of equipment, furniture, things that you can think of. The other day, DFID, which is the Department for International Development for the United Kingdom government, gave us some computers and some tables. We are grateful for that. And obviously, in order to be able to meet the challenges which are big that we face, we would depend and accept any support that anybody can give us. But yes, I can assure you that there are enormous challenges because the work that we are supposed to be doing is technical, it's intensive, and you can't make a mistake because if you make a mistake, you're putting at risk somebody's life. And as you can imagine, that is very, very serious. So if we should give an accreditation to a facility, people should go into the facility with the confidence that whether it's a diagnosis or some kind of cure that is being prescribed is at the right level and is being done by the right personnel and using the up-to-date equipment that we can have to be able to make sure that the standards that we are trying to put in place are the standards that are expected by any user of a health care facility. In 2018, health facilities will see that we would intensify our efforts to register as many facilities as possible. As I said, the Act talks about private and public. Up to now, we've been dealing mostly with the private sector. So we need to deal with the public sector because a lot of people use the public sector as well. Government hospitals, government health centers, government clinics, and things like that. So we're going to have a stakeholder meeting early next month with Ghana Health Service and all the other people who are involved in the regulation of public facilities, right, to discuss how we're going to go ahead to bring public facilities in line with the private facilities as well. So they would be expecting that there will be more intense activity by the agency. They would also expect that we would come closer to them. As I told you about the decentralization, we'll go to the regions and make sure that at least in the regional capitals, we can have the presence of HeFRA. They could also expect to see a functional, reliable website where they can interact with us online, electronically, without having to go in. They should be able to also expect that they will be able to make payments to us online through in other places that they are. They don't have to come to Accra. As we have it now, people have to carry money to us in Accra for us to take from the office to go and deposit in their bank account. That is going to stop very soon, so they will be looking forward to that. They'll also be looking forward to hearing more about HeFRA, either through press releases or either through programs like this one that we are having, or either through the radio. And we're going to be doing a lot of that for people to become aware, because it is a little bit sad to say that sometimes even health professionals don't know about HeFRA, which is not as good as it should be. So we'll be engaging throughout this year. We'll be engaging with more of the other professional bodies, what we call the councils, and any stakeholder, the public, users of health facilities. So we out there, and I would say in their face, we'll make sure that they know what HeFRA is and what HeFRA does. And we'll make sure that they will have confidence that we're going to do a good job for them. I've mentioned National Midwifery Council. I also mentioned the Medical and Dental Council. I also mentioned Pharmacy Council. I also mentioned facility owners, both private doctors, public doctors. I also mentioned, in fact, everybody's a stakeholder. We're talking about health. You would remember that not very long ago, our vice president had to go to the UK to secure some health provision. So everybody, president to the lowest person, so to speak, in the country, is a stakeholder. So when we do engagement, we want to engage it with as many people as possible. In fact, when we do press releases, one of the things that we always say is that if you are a member of the public and you have any concern about any health facility that you visit or you see, or a relative of yours has visited or has seen, and they are not happy with it, they can come to us, let us know what the issue is, and we'll try to deal with the issue. If there's support that we can provide in terms of guiding them to meet certain requirements, we'll do that. If it's sanctions that we need to put in place to make sure that certain requirements are enforced, we'll do that as well. So there's a lot for people to expect from HeFRA this year. The general public to be our eyes and ears when they visit health facilities. So they will let us, because as you can imagine, it's not going to be possible for us to be everywhere at the same time. So we would want their support in trying to ensure that if there's anything that we need to know, we get to know. We would want to appeal to health professionals to help with us to agree certain basic minimum standards in terms of customer satisfaction. In fact, just yesterday, we're talking about patient safety, patient's voice. If you go to a hospital, do you have a way of knowing if something goes wrong, what do you do? Okay, do you have a way of feeding back to health professionals? So we want health professionals to be able, for example, to wear name tags and things like that to ensure that people who are dealing with them will know who they are. So we would want the cooperation of health professionals, doctors, nurses, lab scientists, and all those people who are health professionals. We also obviously want the government to support the agency at the level that it needs to be supported. Our funding comes from three main sources. We have money from the government, which is called the GOG, Government of Ghana help. We have money that we generate ourselves, because all our activities that we engage in are chargeable, okay? And there are charges that are agreed by Parliament, so we don't just go and charge people anyhow. So there are charges that are agreed by Parliament. So we get what we call IGF, or Internal Generating Fund. We get that. We can also get loans. We can get grants. We can get sponsorship from different organizations. Now, if we are strong enough, and banks can have credibility in us, in our ability to deal with our finances, an agency like HeFRA, which has got a great future and a great potential, shouldn't find it very difficult to secure loans to purchase and secure some of the things that we need to have in place to be able to do our job as effectively as the Act expects us to do. Thank you very much. And as I said, thank you very much for this opportunity. And I hope we can continue with the engagement, similar engagements, to be able to bring this home to the general public and to make sure that this, as an agency of the state, is really doing what the state expects the agency to do in the provision and the delivery of health service or health care to the people of Ghana. Thank you very much. Thank you. If you need to contact us, and I hope and I believe that you would have a need to contact us, either because you want to register or you have some information for us, or you just want to come and get some general information about health regulation. We are located on the 4th Circular Road, number 31, 4th Circular Road, in cantonments between the Togo Embassy and the American Embassy. If you want to check us out online too, our website address, which we are currently developing, and very soon it will be live and functional, it's www.hefra.gov.gh. You can also send us an email straight away. That is already working, and it's info@hefra.gov.gh. You can also contact us by telephone by ringing the landline number 0302 900 995. We are open in the morning from 9 o'clock till 5 p.m. every day, except for Friday, when we close a bit early at 4 o'clock. But please feel free. We are also trying to put in place an answer phone that you can call us and leave messages for us outside office hours. So thank you very much. I do really appreciate this opportunity to talk to people, to talk to Ghanaians about what HeFRA stands for, Health Facilities Regulatory Agency, and what is it that we are doing, and what is that we need you to do to help us become effective in health regulation in the country for both public and private facilities. Thank you very much. We are, as I said, very grateful to DTV1. So if you do want to get more information about the agency HeFRA, please tune in to DTV1 for more information. And I'm sure our partnership with them will carry on, so we can, from time to time, bring you some very useful information about our activities through their channel. Thank you.